So we recently published a systematic review, or you could maybe also call it nowadays, we can call this kind of review like more like a scoping review. We were not really sure what should we call it, but we looked very systematically at the literature of transient neonatal Myasthenia gravis, which is a growing literature, but this is a rare disease, and it has a very interesting specific pathology. As I told you, this is the autoantibodies that are mediating the disease, but although the autoantibodies always transfers to the child, not all children have the disease. We don't know everything about this disease. We need to know more. We need to know more why not everybody gets it, and also why it sometimes occurs with a delay. And we would like to predict it. We would like to be able to predict it during the pregnancy or even before the pregnancy. So there are only a few things we know now about prediction. We know that it is highly recurrent if the woman has had it before, and it is also associated not only with another sibling with transient neonatal Myasthenia gravis, but also with permanent skeletal malformations such as arthrogryposis, multiplex congenita, but perhaps also milder forms of skeletal malformations. So we think that it's a prodrome phase, that when the child has reduced fetal movement, first you can get the deformation of a hand or a foot, and this we could, in theory, find in the ultrasound during pregnancy. So I think we should be more aware, we should be more active, and all pregnant women with Myasthenia gravis should have extra ultrasound to look for this, specifically look for skeletal malformations, reduced fetal movement. We need to be better at looking at it. The treatment approach is currently not really clear, so we believe that if you use immunosuppressive medications or intravenous immunoglobulin, it will reduce the risk. But there is not really systematic good papers yet on this, and I think that we need to have that. So hopefully we can do it with our Nordic pregnancy registries. So we are planning to combine several country registries and look at this kind of thing, the effect of the medication. But currently we believe that a better controlled disease, a planned pregnancy, and thymectomy in advance, probably long in advance, is better than short time in advance before the pregnancy. So this we should keep in mind, that thymectomy for women with childbearing potential should be performed also for the sake of protecting the child in a future pregnancy.